Thank you for joining us for today's Practice Advantage Pearl. Today I'd like to talk about getting everything in line. And I'm thinking about today service line implementation. Perhaps you're a new physician to a health system and they've asked you and tasked you with starting a new service line, whether it be maybe spasticity management, it might be movement disorders, it might be a pain service. Maybe you're not a new physician. Maybe you've been a physician in the system for a while and they've decided that now's the time to implement a new service line. Or perhaps you're a private practitioner, you have an agreement with the health system, and they've really tasked you with helping develop a service line. The idea and the concept have come to bear, the principal people involved in it, and also the pro forma, the business plan, and the funding have been established at this point. So now, how do we implement that service line? How do we get things going? One of the starting points is assuring that your core team is together. Who are those key individuals? They're identified and they're engaged in this process. Not just the principals, but those people in the health system. Next, you'll want to look at where are those patient referrals going to come from. Making sure that you identify with your core team and your principals those referral channels and knowing where those referrals might come from. Next, you look at the key links within the organization. Are there existing departments that go hand in glove with the service line that you're developing? And are there several of them? So you need to identify what those links are, and they may be on different campuses within the health system actually. From there, you go to taking a look at developing the education that's going to be required for this to be successful. How do you implement the strategies themselves given a good education schedule? So here it might be starting with provider education, nurse practitioners, physicians that might be referring. What is this service line all about? If it's spasticity management, do they really understand that? Are there standards of care already in place or care plans already in place, or do they need to be redone or started from scratch? Do the physician orders allow them to get to this particular service line? Does the electronic medical record or the electronic health record have incorporated into it the appropriate templates and ways to manage these particular patients also? Then, are the resources that are out at these different parts of the health system integrated enough to ensure that the provider is going to be able to be successful with this? And lastly, on that educational tree, you want to think about patient education. How do you educate patients and families about this new service line within this system? Now, if I jump over to helping assure the success, we need to talk also to our key opinion leaders and our change agents within the organization. Those people within the organization that can really impact change. For them, for the referral sources, for everybody else, we need to increase awareness. That takes us back to that education channel again, looking at how do we educate everybody and increase the awareness in the community for that. Next, the devil's in the detail, as they say. It's operationalizing everything, getting everybody ready to go to launch the new service. From there, it's going to collecting the data out of the electronic medical system and the other systems that are in place across the healthcare environment to look at what data are we collecting, is it important data, moving that data then back into that continuous improvement cycle, and also putting it into another opportunity for influence management, which is converting some of that data into case management so that people understand on a patient-by-patient basis what this service line looks like. I'm sometimes better at seeing these things visually, so I'd like to take a minute to maybe draw this out so we have a chance to really look at what this looks like visually. Thank you for joining us for today's Practice Advantage Pearl. I wish you continued success as you try to get everything all lined up.